Welcome to Marrow Masters, sponsored by the National Bone Marrow Transplant Link, Insight Corporation, and our esteemed Link partners. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplants from diagnosis through survivorship. This season of Marrow Masters focuses on chronic graft versus host disease, or GVHD. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Welcome to Marrow Masters podcast series. Today we have Dr. Joseph Uberti of the Karmanos Cancer Center in Detroit. He will be talking to us about the basics of chronic graft versus host disease, what it is, why it happens, and much more. Welcome, Dr. Uberti.
Thank you for inviting me to take part in this series. I think it's a wonderful way to get information out to patients about some of the troubles they may face going through transplant.
My first question for you today is, could you please provide the definitions of acute and chronic graft versus host disease?
As you know, when patients go through transplant using a donor, sometimes the donor cells can react against the patient in this inflammatory reaction. And this inflammatory reaction, where the donor cells are really seeing the patient's tissue as foreign and reacting against it, is called graft versus host disease. It's usually broken down into two different varieties. First, there's acute graft versus host disease. And by definition, that usually occurs within the first 100 days of the transplant period. During that time, the donor cells can attack various organs in the patient, and it's usually targeted against three separate organs: the skin, the liver, and the gastrointestinal tract. We use a number of medications to prevent that inflammatory reaction of the donor cells against the patient cells. But even in spite of those medications we use to try to prevent that, there is some chance of patients getting this type of inflammatory changes within the first 100 days. By definition, graft versus host disease that occurs after the first 100 days is usually termed chronic graft versus host disease. Now, this time frame is somewhat arbitrary, and the numbers really don't always really define the disease. And the diseases are usually defined more by how they manifest themselves, what organs are involved, and what sort of treatment we use for them. So chronic graft versus host disease, again, usually occurs about 100 days after the transplant. The way it happens is a little bit different than acute graft versus host disease, and the organs that are involved are a little bit different.
Thank you so much. What are the signs, symptoms of chronic graft versus host disease?
So just to remember that acute graft versus host disease usually affects the skin, the liver, the gastrointestinal tract. Chronic graft versus host disease affects other types of organs, and they have other types of symptoms. And the organs involved in chronic graft versus host disease can be much more diverse than those in acute graft versus host disease, and the signs and symptoms are far different from acute graft versus host disease. Just to give you an example, in acute graft versus host disease, you get a macular papular rash on your skin. In chronic graft versus host disease, although you can get skin involvement, it's much different than what you see in acute graft versus host disease. So the symptoms of chronic graft versus host disease can come on quite insidiously. And by that, I mean it may be very mild symptoms the patients are having, and they may not even notice that this is that much abnormal from what they normally feel. So as an example, very often, patients start to have dry eyes. Their eyes feel a little bit drier than normal. They sometimes come up with crustiness in their eyes when they wake up in the morning. But that is maybe a mild indication of chronic graft versus host disease developing their eyes. The other thing we also hear a lot of is dry mouth. So patients have difficulty eating some food things such as bread, things like that, make it very hard for them to swallow. Their salivary glands are affected, so they feel very dryness of the mouth, which sometimes does affect their eating ability. The other symptoms that people often complain of is changes in their skin. Their skin begins to feel tighter. It isn't as flexible as it was before. They cannot move as well as they have in the past. So these are very small symptoms, but they are sometimes the first indication of chronic graft versus host disease. There are other things that may be a little bit more noticeable. Certainly, if the lung is involved with chronic graft versus host disease, as it can be in some patients, they can develop more shortness of breath, more difficulty walking upstairs. They notice that they don't have as much energy as they've had before. And that's the other thing that can sometimes be an insidious symptom of graft versus host disease, patients' energy level. They just don't have as much energy as they've had before. They're more fatigued. They're taking more naps. They just don't feel as well as they've had before. Sometimes those are all part of the signs and symptoms of chronic graft versus host disease. So sometimes it's very difficult to say. It's not that you're going to have a tremendous rash, but sometimes the signs are subtle. So you need to let your physician know about some of the things that are going on with you that you may not even think are problematic. But you need to let your physician know because these may be some of the first signs of chronic graft versus host disease.
Well, thank you. Also, what are some of the possible sites, organs that may be affected by chronic graft versus host disease?
Just to differentiate acute from chronic graft versus host disease, acute graft versus host disease just affects 3 different organs: the skin, the liver, and the gastrointestinal tract. Chronic graft versus host disease can develop in many more organs than acute graft versus host disease. And that's why it is so much more of a difficult disease sometimes to treat. So if we start from the top of your body and just go down to your bottom of the body, we can talk about all the organs that may be involved with graft versus host disease. First of all, it can affect your hair. It can cause hair loss, thinning of the hair. Sometimes that's the first sign of graft versus host disease. As we go down, it can affect your eyes, causing dryness of the eyes and xerophthalmia. Dryness of the eyes, dryness of the mouth are also very common signs and symptoms of graft versus host disease. As we go down further, the lungs can be involved with graft versus host disease. Again, the symptoms may be subtle, but symptoms may be more severe, causing more shortness of breath, maybe more sputum production, more changes on lung x-ray or even a CAT scan of the lungs, maybe some of the first findings of chronic graft versus host disease of the lungs. As we go down further, some patients have weight loss as signs and symptoms of graft versus host disease. It may not be even associated with nausea, vomiting, or diarrhea, but weight loss can occur with chronic graft versus host disease. In women, one of the major features of chronic graft versus host disease can be vaginal dryness, atrophic vaginitis, which can be a very difficult problem and may require specialized care. The skin is another major organ of graft versus host disease that's chronic in nature. Again, very different than acute graft versus host disease. The skin may have some changes with tightening of the skin or scleroderma type changes of the skin. You can have vitiligo, changes in the color of your skin. Sometimes patients have lichen planus, changes in their skin. The skin becomes darkened in certain areas. And sometimes that tightening of the skin can be very dramatic to the point where it involves your joints. So the joints can be involved, so that it makes it difficult for you to move your arms, your legs, your hands. So you lose a lot of mobility in the joints. Other types and manifestations of graft versus host disease include fluid accumulation. We've had patients who have had fluid accumulation around their heart, in their lungs, in their abdominal area. So it's a generalized fluid accumulation, probably from graft versus host disease, that can be very devastating if it surrounds your heart, as an example. It can make it difficult for your heart to beat appropriately. So that's a pericardial effusion that we sometimes see with chronic graft versus host disease. So as you can see, many organs can be involved with this disease. And very often, even subtle changes that you may notice, you should bring up to your physician and let them know, because it may in fact be some of the first signs of chronic graft versus host disease.
So Dr. Birdie, we hear a lot from patients about their fatigue. It's just so hard for them. It's maybe one of the hardest parts of their graft versus host disease. Would you like to weigh in on this topic?
Fatigue is a difficult part and also part of the process of chronic graft versus host disease. It can be very multifactorial in all the complications that occur with our patients. As an example, patients can be fatigued from a low hemoglobin level, so sometimes it does require a long time for your hemoglobin level to normalize. Patients have been very deconditioned as they went through the transplant, which can contribute to the fatigue. There are changes in their hormonal levels that we've seen in men and women that can contribute to the fatigue, and also changes in thyroid function. So there are a number of things we have to monitor when patients tell us they have fatigue. And then unfortunately, graft versus host disease does cause fatigue in our patients. So the treatment of those certainly is try to treat the underlying cause of it. If it's anemia, if it's a thyroid problem, if it's another hormonal imbalance, we try to treat those. But sometimes the underlying way to treat it is try to get the chronic graft versus host disease under the best control possible. And sometimes that may be very difficult. I must say many of our patients complain of fatigue. It's a very common problem. Patients are taking frequent naps during the day. They just don't have the energy to do things. And it's a very difficult thing to treat because it has to be the same treatment that we're using for the chronic graft versus host disease. It is a tough problem for us, a tough problem for our patients. They are very frustrated by it. We are very frustrated that we can't treat it very effectively in certain cases. But we do try to make sure we can reverse the things we can to try to minimize the contributing factors to the patient's fatigue. We do often very much make the recommendation that patients should try to get into a regular exercise program, Physical therapy is an important aspect, I think, of our patients to try to overcome this fatigue. So we do encourage them and formally make the recommendation that most of our patients should undergo fairly intense physical therapy after transplant to try to improve their fatigue, try to improve their muscle strength. Some of the medications we use cause muscle weakness, so we have to overcome a lot of that with what we do to our patients to overcome the fatigue they often see after transplant.
What is the risk of developing chronic graft versus host disease, and why exactly does it happen?
Well, the risk of developing chronic graft versus host disease varies based on a number of features. In general, anybody's risk of graft versus host disease is generally in the 25 to 50% range, and a lot of things alter that. As an example, what type of transplant you have. Is it a bone marrow transplant? Is it a stem cell transplant? That can affect your risk of developing chronic graft versus host disease. What type of immunosuppression you use can affect a chronic graft versus host disease development. And also whether or not you've had acute graft versus host disease. People who've had acute graft versus host disease have a greater chance of developing chronic graft versus host disease. So why does it occur? Well, it occurs really because of the same reason acute graft versus host disease occurs. Your donor cells is seeing your body and various portions of your body as foreign and reacting against it. Again, the symptoms are different than acute graft versus host disease, but the underlying cause is the same. There are differences between your cells and your donor cells are seeing those differences and really attacking and trying to change the pattern of your normal cells. Much of the symptoms of chronic graft versus host disease are very similar to patients who have autoimmune disorders. So as an example, patients who have chronic graft versus host disease develop scleroderma-type skin changes, just like patients who have scleroderma. A lot of patients develop dry eyes, dry mouth. Again, that's very common as symptoms of an autoimmune disorder. So it's very similar to some of the autoimmune disorders we see in patients who don't go through transplants.
We hear a lot from patients that they don't know if it's their chemotherapy or their graft versus host disease that's causing some of their symptoms. Does that fall along the same lines?
So usually what happens, the chronic graft versus host disease is a late stage phenomena. It's when you've really had all of the effects of the chemotherapy are gone by that time. Now, it can be that some of the long-term side effects of the chemotherapy can predispose you to graft versus host disease of the chronic nature. But in general, we think this is generally due to your donor cells attacking your organs, not really a residual effect of the chemotherapy. But it could be that some of the chemotherapy you had for your transplant, or even before the transplant, predisposes you to develop some of the symptoms and signs of chronic graft versus host disease.
We hear a lot from patients that after they leave the transplant center, they go back to their lives, and their medical provider, their doctor at home, sometimes they're teaching their doctors about GVHD. They don't always know everything there is to know about it. Are there any questions you could offer patients that they might want to ask, or a way for them to be able to be treated better when they go back to their lives in their hometowns?
Well, I think that's difficult because chronic graft versus host disease is a disease that's really only seen in transplant centers and people who do transplants. So I think it is very difficult for the referring physician sometimes to know what the signs and symptoms and the treatment options of graft versus host disease are. We try to provide some guidelines to all the patients and their families and the referring physicians, but it is difficult because they haven't had the experience and they haven't seen some of these diseases before. So I really urge our patients and their physicians to keep in close contact with the transplant centers. We have a lot of literature we can provide to the physicians and their families. We're always available by phone or constant interaction. And we do recommend that most of our patients continue follow-up with us if they have chronic graft versus host disease, even if they do live far away for sometimes a long period of time after a transplant. And that's what makes this disease difficult for our patients, because it can be a very chronic disease, go on for months and even years. And we've had patients with chronic graft versus host disease now for 10 or 15 years that we continue to follow. It is difficult, and it may require you to continue following up with your primary bone marrow transplant physician, just because much of the expertise is there. And the primary care physicians, the referring oncologists, really don't have much experience treating these diseases, as you would not expect, because they don't do transplants everywhere.
That makes sense. Well, thank you so very much for the basics of chronic graft versus host disease. We really appreciate the opportunity to ask you these questions today. Is there anything else you might want to add?
I think chronic graft versus host disease can be a frustrating disease for patients. And it's something we really have to work better on to improve our outcomes with this. And it does become frustrating for physicians treating it too, because there's no easy roadmap that gives us the exact way to treat every patient. So we have to go through a number of therapies. We have to go through a number of treatment options with our patients to try to find the right one to individualize it for that patient's needs. And very often it's trial and error involvement in trying to find the best treatment options for our patients.
Dr. Uberti, thank you so very much for your time today, for taking the time with us to explain this. I know that it will help so many patients.
Well, thank you very much, Peggy. It's been my pleasure.
This has been the Marrow Masters Podcast. Feel free to share this episode via social media, text, or email. To hear more, subscribe for free to Marrow Masters in your favorite podcast app. To learn more about Graft Versus Host Disease and the resources available to patients and caregivers, check out the National Bone Marrow Transplant link at nbmtlink.org. That's nbmtlink.org, or just tap the link below in the show notes.